Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, I have to admit that I have a bias on this particular study, but this bias is clearly backed up by pretty much every research study that has asked the question. In addition, I was part of part of a provider advisory panel for Optum, which is a subsidiary of United Healthcare, and I saw some of the numbers and how much chiropractic care affected outcomes when it came to non-surgical back pain. The problem we see, two things. First of all, on social media, I hear people say there's no evidence, it's hoopla. They clearly have not actually looked at the volumes of evidence. But the thing to understand is that when you really look at studies looking at chiropractic management, not the chiropractic adjustment, big difference, you find that chiropractic management of a case, which involves lots of different things, not just the adjustment, we pretty much rock and save costs, massive costs. So in this particular study, looking at 44 different studies from RCTs to cost comparison studies, they found that chiropractic care lowered costs, both initial costs. Sometimes initial costs are about equal, maybe a little bit higher, but when you look at episodic costs, so not only about 70% of chiropractors manage a case in-house, and so we're not referring out for imaging, for pain management, for pharmaceutical, and that's where too many cooks in the kitchen don't improve care. They provide for what's called discordant care, and worse outcomes, more expensive outcomes. So it certainly makes sense that when you look at an episode of care, chiropractic care comes in at a substantial cost savings, sometimes 60 or even 2/3 less cost than other provider types like orthopedic surgeons, PT, primary care doctor. Which again also boils down to like United Healthcare had a huge study looking at chiropractic care. Had a chiropractor been as the first portal of entry, they're saving like $1.2 billion over the course of 3 years. It's because of this management of these cases. So when they looked at the 44 studies, they found that lower use of opioids, big shocker there, lower use of surgery, lower use of hospitalizations, lower use of ER, lower use of specialists, lower use of injections. And imaging is in there somewhere. But those themselves are massive cost savings. When you start looking at not only lowered risk of opioid use, but also NSAID use. And when we look at that, we look at the cost of NSAIDs, which is really pretty minimal. We don't look at the side effects of NSAIDs. Strong links between things like heart disease, cardiovascular disease, and NSAIDs are strongly linked. It all started from the whole Vioxx debacle. So imagine the drug that killed 100,000 plus people. Like if they had seen a chiropractor first, maybe they wouldn't have been on the Vioxx in the first place. NSAIDs affect on cardiovascular disease, but also renal effects, liver effects, the ulcers. It's a long list. So when you start looking at all of that and encompassing all of that, chiropractic management of a case is a massive cost savings. We are probably the most cost-effective treatment in healthcare today, granted, or for musculoskeletal cases, let's put it that way. Granted, for cancer or something like that, not going to be cost effective, but for musculoskeletal case, and keep in mind orthopedics, non-surgical back pain is the primary cost driver for almost every health insurance, if not all health insurance plans, mainly because of its volume and because how much of it's mismanaged with imaging, pharmaceutical, and pain management. So again, I noted I have some biases for obvious reasons. I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.